Hello everyone, Dr. John Bartemus here today with functional medicine patient Kate. And Kate's done a video for us before, but now we're about 16 months out from her beginning of care, and she's here to give us another update. So just a recap, why'd you come, where'd you start, and go from there.
I was in a bad place. So chronic fatigue, I wasn't cycling, menstrual cycle was completely off, hadn't for years. I had severe digestive issues. I was diagnosed with Crohn's disease when I was 15, and I've had a variety of different paths that I took trying to solve that in the traditional sense. So pretty much every medication that you could name. I had a resection surgery when I was 22.
Wow.
And after all of that, still having symptoms, still battling it on a day-to-day basis. And the solution that I was given when I went to a traditional doctor was, we'll add more medication. And that wasn't a solution that I was willing to accept. And although I've been told many times that food and diet and all of those different things didn't really affect my disease, I just didn't quite believe them.
Yeah, thankfully.
Yes. So, you know, I was really feeling very hopeless and feeling very out of control as far as where I was going to be able to be in the next 5, 10, 15 years. You know, the outcome wasn't looking very good.
Right.
And, you know, just to put it in perspective, when I made the decision to take a type of care that maybe wasn't going to be covered under insurance the same way, I kind of looked at it this way. You know, I was taking a medication that probably cost $1,000 a month. Now, insurance covered some of that, but not all. And the potential side effects from that drug were cancer, brain lesions, other very severe life-threatening illnesses, and it still wasn't treating the Crohn's disease.
Right.
So I was getting all of the negatives without any of the positives. And when I looked at what I was willing to spend to get my health back, it really kind of was an unlimited number. You know, if it made sense, if it was going to get me where I needed to be.
Right. And so speaking off camera, she had also said that she knows patients, other people with Crohn's disease, and they see her today and how well she's doing, and she. You know, what do you say to them and what do they say?
Well, you know, I tell them about all the lifestyle changes that I've made. You know, I haven't, I've been gluten-free for probably 2.5 years, but I've taken it even steps further, right, from a diet perspective and making sure that I'm focusing on getting nutrient-rich foods that promote health versus detracting from health. And, you know, the common reaction that I get is, wow, that seems really drastic. And when I walk them through the years before I started approaching my disease this way, you know, talking about having surgery, major surgery.
As in colon taken out.
Yeah, partially, a colon resection, and, you know, the vast variety of medications that I was on, and like I said, the negative side effects that I was facing from those drugs. I mean, it's kind of like what's drastic, you know?
Not eating bread is drastic. I'd rather have the surgery.
Yeah, exactly.
So in the previous video, you had spoken about how at that point, I don't know, maybe it was 6 or 8 months ago, you hadn't had a Crohn's flare-up since the start. You had been cycling. Your cycle had started back full there for the first time in years. So those two things are still same? Yep,
absolutely. And you know, one of the kind of indicators that you and I have been looking for is my iron levels, and we really hadn't been able to get those to budge. And I've been chronically anemic pretty much since my Crohn's diagnosis. And you know, just recently, after really working and tweaking and fine-tuning some things, we've been able to start getting that number up. And the health benefits from that, you know, better skin, hair, nails, but also just internally, metabolism, being able to do the things that it needs to do. So really every day it's kind of getting a little incrementally better, but right now we're just fine-tuning and tweaking things.
Yeah, so from the last video, what she's talking about is, you know, we knocked out the Crohn's symptomatically, and we got her cycle back, so a lot of people will be like, okay, good, we're done. But she is of the mindset that she wants to be life at optimal, which is what I'm all about as well. So she said, well, let's fine-tune these other things. Some of it had to do with some thyroid dysfunction and imbalances and some gut dysbiosis and things of that nature. So we've addressed that, and she came in today saying she's feeling phenomenal. And so what are the next steps for you?
Yeah, so really right now it's about maintenance. So I'm in a really good place. and I've put in the hard work. It is hard work, you know, you have to make it a priority, but at this point, you know, really is looking at just continuing the success that I've had, continuing to make those choices from a lifestyle perspective, and continuing to feel good every day. I think that's, we talked about how until you feel fantastic, you don't realize how crappy you were feeling. And every day I was feeling like junk. And throughout this process, you know, it's gotten a little better, a little better, a little better. And, you know, when I get a little bit of a head cold, it's like, wow, this is, you know, just reminds me of where I was in that place, right? Because every day I'm feeling so phenomenal that it's really enlightening.
Yeah. So I heard a quote this week that another patient had thrown on my Facebook, and she said she had heard it. It says, "Your doctor should be your swim coach, not your lifeguard." And I thought that was very powerful because Kate's a perfect example of someone who is looking for a swim coach. You know, she went into the mainstream medical system, which is only full of lifeguards. Okay, they don't react until you're drowning, and all that did was cause her to lose a part of her colon and spend a lot of money on drugs that induce cancer and basically keep her in that system. So ultimately, she said there's got to be another way, and she sought out a coach and found one. And so this wasn't me curing her. This was us working as student teacher and working together to get her to a point in life where she's very happy and excited and hopeful about the future, which is huge. And then she's learned the skills to now, if you're a good teacher, eventually the student becomes the teacher, right? So she's learned the skills to, now we'll communicate maybe a couple times a year, and she'll be able to go out and continue to live life the way she wants to and help other people along the way.
Yeah, absolutely.
So, Kate, I'm proud of you.
Thank
Great
you.
job. And if you out there are wondering, can I help you with your ailments, please reach out to functionalmedicineCharlotte.com. You can see me on my YouTube channel if you YouTube Dr. John Bartemus, or listen to my podcast called Accelerate Health with Dr. John Bartemus on iTunes. Have a great day.